Okay, thank you very much.
Thank you.
Thank you.
Thank you, Carol.
Thank you.
Carol. See you soon. Bye-bye.
Well, now Caterina Elisabetta Rizzo will present us the isolation multiresistant bacterial strains from dairies wastewaters, a public health concern in a One Health perspective. Caterina is a student of a course of specialization in medicine and hygiene of the University of Catania. Please, can you talk about your work?
Oh, good morning, and thanks to the moderator for the presentation. I want to thank even my professor, Pasqualina Laganà, which is the leading group of this study. As the title says, we evaluated the antimicrobial resistance in dairies wastewater. But first of all, we need to see a bit of background, the context. As you can see, there is a map of Europe. It's a bit dated. It's of 2016, but the situation is still more or less there. So, as you can see, Italy and Greece have in this map the highest daily for antimicrobial resistance. And even this, as you can see in the graph down there, the deadly infections sustained from antimicrobial resistant strain, such as Escherichia coli, Staphylococcus aureus, Klebsiella pneumoniae, Streptococcus pneumoniae, Acinetobacter, and Pseudomonas species are the most deadly, almost the 80% of that attribute directly to antimicrobial resistance. So in our country, nearly 7 to 10% of patients each year undergo to these kind of infections, causing thousands of deaths. So, as you can see even here in this card from CDC, antibiotics are known to be used in veterinary medicine, zootechnics, agriculture, and aquaculture, not only just to maintain animal welfare and food safety, but also to prevent infections or simply promote growth. So, a large use of antibiotics in food-producing animals encourage the development of resistance. So as you can see, from resistance to the spread, and then human exposure till the impact, as I previously said, with daily, from mild illness to severe illness till death. So it's important to raise consciousness on the emergence of these bacterial strains and resistant to antibiotics. So we, as I said previously, we evaluate in the reproduction chain this problem, and it represents the one potential of antimicrobial resistant transmission route, as if in United States, as told FDA, nearly 43% of medically important antibiotics used in animals were administered in beef and dairy cattle. So, once again, we evaluate some wastewater collected by dairies located in Sicily in order to determine which was the potential role played by this context in the spread of antibiotic resistance. So we focused in 31 facilities located among the 9 provinces of Sicily. The processing facilities were distinguished by the type of the milk processed. So we, moreover, evaluated the purification plants, and at the very least, we also took samples from the mixture of milk, milk-based products, or derivative with waters. Our results. Okay, so we isolated these strains from the samples, and the most frequent found genera were Aeromonas and Vibrio in equal percentage, followed by Enterobacter and Sidrobacter species as the most detected genera, followed even more from Pseudomonas as second. Nearly the 50% of the identified strains were found in wastewater from artisanal plants that did not have a purification system, and the wastewater were discharged straight into the sewer. Regarding antimicrobial resistance, we found out that macrolides, titracycline, tetracycline, rifampicin, were the antibiotics with the highest mean percentage value of resistance, followed by penicillin and cephalosporin with also a higher percentage of values of antimicrobial resistance. But regards to cephalosporin, fosfomycin, macrolides, monobactams, nitrofuran, and quinolones, the mean levels of antibiotic resistance was lower than the other cited before. In conclusions, according to WHO, in 2050, we will have about 10 million deaths from antimicrobial resistance. Regarding antimicrobial resistance, bacterial are found in large quantity in livestock and agri-food sectors, and the presence in wastewater from processing facilities may contribute to, obviously, an environmental pollution by these germs. And Italy undoubtedly ranks among the nations with the biggest milk productions. So, biggest milk productions may mean even more antimicrobial resistance. And according also to our study, these plants collection wastewater were tainted with bacteria that are resistant to antibiotics, which can be a significant cause of environmental contaminations. So it's important for all these plants that to have a purification system, even in that small facilities that only process only little amounts of milk, especially harmful for not only the animal species, but even for human health. From this, I say thank you.
Do we have any questions? Yes?
Yes.
Thank you for the presentation. It was very interesting. I was wondering if you are planning to do another study to compare probably the prevalence of existence of bacteria. Sorry. And other areas that have the same tendencies of use of milk or.
Oh yeah, it could be an interesting develop of the study to see if there is even a difference in our milk, our dairy production, for example, in Sicily, and see if this problem is similar even to other facilities, even in the same Italy. I mean, we have this situation in Sicily, but I don't know in Lombardy or in Tuscany how it could be. So it could be interesting to develop the study as a multi-center study and to verify if there are differences in the application of the European regulation regarding the purification of wastewater.
I also think that it could have a lot of potential
to
see the comparison. And
it's a preliminary study anyway, so...
Perfect. I mean, I think it was a very good one and could be even broadened up so it could benefit all the countries.
Of course.
So I applaud it. Yeah, thank you.
Thank you.
Any other questions?
Okay, thank you.
Thank you.
Thank you, very interesting, very nice presentation. And now Rossella Grappa from the University Federico II of Naples.